Hello, everyone. Welcome to our presentation. I'm going to go
Hello.
ahead and work on sharing the screen, all learning technology. So today we're going to be talking to you guys about the SLUMS assessment. I'm Krista Schmieder.
I am Sam Stevenson.
And welcome.
And welcome. Awesome. So what does the SLUMS stand for, you might ask? Great question. It stands for St. Louis University Mental Status Exam. So this exam or assessment is really targeted towards measuring one's cognitive ability. So it has it has 11 questions and it's scored to 30 points. And it's going to measure that cognitive domain. So within that, it's going to look at attention, immediate and delayed recall, orientation, numeric calculation, visual spatial functioning, and just executive functioning in general. You can kind of see some of the questions on the right hand of the screen. That's actually the SLUMS test itself. So kind of some orientation questions at the beginning, and then continuing into a varying of tasks. So going back to scoring, you can kind of see it at the bottom too. It says 27 to 30 is normal. And we'll talk a little bit later about education level because that has a role in scoring. So someone with a high school education or greater would have that scored between a 27 and a 30 would be considered normal, so just no cognitive disability. Someone who would score between 21 and 26, that might indicate that they have a mild neurocognitive disorder, and then scores 20 and below suggests dementia. So we have a little clip here to show you guys that's going to talk about like an kind of give an example of this woman in the blue with the white coat. She's talking to a patient and she is giving the SLUMS verbally to this patient, and she's going to ask a question on the SLUMS, and you can kind of see the patient's response.
Tricycle for $20. How much money did you spend?
$23.
Okay. And how much money did you have left?
$77.
Okay. We prefer to use the SLUMS for assessing cognitive function because it's much more sensitive than some of the other tools that are available. And it also allows us to stratify individuals early before they actually are fully demented, and perhaps at that point intervene and make the diagnosis earlier. Now, I'm going to have you name as many animals as you can in 1 minute. All right? So I'm going to set my watch. Ready? Begin.
Cats, dogs, horses, cows, birds, parakeets, parrots.
One of the questions that people frequently have problems with is naming of animals. They have 60 seconds to name as many animals as possible, and we're hoping they can name at least 15 animals. They do not get points if they rename the same animal more than once. And what we frequently see is people will think of animals within a certain category, say barn animals or zoo animals, and they won't be able to transition to another category of animals in order to think of 15 or more. Earl?
Awesome. Okay, so as you can see there, and kind of what Sam was saying, this is a very great test to be using. Like the lady was saying in the video, it's really a lot more sensitive than some of the other tests. Like in some of the research that we were looking at, we saw that compared to like the mini mental, this is a lot more sensitive, which means that it's better at detecting early onset dementia just before it gets to that point. So I'm going to go ahead and go to the next slide. And kind of like what Sam was also saying before, something to note is that a really great thing about this exam is that it does include education level. So it kind of levels the playing field for a lot of these patients because if you're coming into it with a doctoral degree as an OT versus coming in as someone that doesn't even have a high school education, it shouldn't really be graded the same. So it's good that they include that. And some other things to note is that OTs are not the only ones that can administer this exam. So some people that can do it are like program coordinators, nurses, nurse practitioners, physicians, OTs, and PTs, and more. As long as they have had the proper training in this, they can administer it. And typically the patient population that they're administering these tests to are to screen for Alzheimer's, for dementia, and or to check the presence of a cognitive deficit. So this can also be used in like the ICU or acute care to see their cognitive levels after getting out of a surgery or something as well. And you typically would do this with older adults or non-specific patient populations. And like I said earlier, that education factor is really important.
Awesome. So if you were to look back at our ICF and you were to look at the domains that are listed there, you would see under body function, that's the specific domain that this test is going to assess for, and specifically cognition within that domain. So like I was talking about earlier, attention, immediate recall, things like that are all going to be affected in these executive functions. So one example of a deficit that you might see that presents if you were to give this exam would be in memory. And in memory, we have to recognize that we need to be able to order things step by step and remember those steps. So just an example of an IADL that we might do day by day is cooking. So if you're cooking for yourself, cooking for others, if you can't remember the steps that you need to perform in order to cook whatever you're trying to cook, you're going to have a really hard time making that food and having it turn out the way you want it to. Even if it's something as simple as Kraft mac and cheese, there are still steps that you have to follow. You have to boil the water first and then add the noodles, or else you're going to have soggy noodles. And then you have to drain it and then add the cheese and the milk and things of that nature. So if you mix up those steps, you might have really soggy noodles, or you might have hard noodles. So we could maybe find a way by writing these steps out and having the person have a checklist or something to check off these steps. That could maybe be a way to compensate for a deficit seen here. So that's just one example of a deficit that you might see on one of the questions on this exam talking about memory. So can you guys think of other examples where you might see a deficit with that could be seen on this exam?
Wow, guys, that's great. That was really great input. I really liked what you said, that IADLs and ADLs, yes, but also some of the other things like all of the education and different occupations that are involved that we've learned about in our past classes. Everything is pretty much affected by this, because other domains too are involved here, and we'll kind of talk about those a little bit later. But I really like how you guys are saying that, and also saying how even with the task of cooking, there's other things that come into play that could be affected by that as well. That was really great, guys. Thanks for participating with us. Okay, so we're going to go ahead and go on to the next section. So at first, when we were researching this section, it was very overwhelming because, as you guys know, in the neuro class, we're learning a lot about the brain and everything that it does. And this test specifically is testing attention and working memory, cognition, executive functioning, mental health, reasoning, and problem solving. And just by Sam giving that example earlier, you can see how one thing, memory, can completely alter the way that you perform a task, because it's only one part of your brain is being affected, but it's affecting a lot of different things as well. So we could really go into this all day about how many different parts of your brain are affected and used in this assessment, and how those present differently. But we're going to kind of focus on executive functioning because that's one that's altered a lot and tested a lot in the SLUMS. So if you guys don't really know or haven't been refreshed on it, executive functioning is defined as the higher level cognitive skills used to control and coordinate your other cognitive abilities and behaviors. So everything is pretty much involved with that. But it is associated with the frontal lobes as well as the cortical and subcortical structures that connect to the frontal lobes. So I'm going to move my cursor around and you can see the prefrontal cortex here. And looking at things just near it, even in some of the research and stuff that we've said, the SLUMS can even test for some language stuff and some other things in the other areas because they are very close together. And if some of these higher executive functioning zones in your brain are being affected, that can in turn affect other things as well, which we've all been learning about. Our brain is very complex and a lot of things is going on. So that is why this test is really important, because it can help us to catch things early so that we can start working with patients, like Sam was saying, helping them create checklists and working on that memory loss and loss of executive functioning and things so that these patients can age out well and we can start working on these things early, which is a lot of what OT is about. So these are our references. Thank you guys for coming. And is there any questions that anyone has? Let's pretend we answered some questions. Great.
Yes, and we have
Now that we are finished, we're going to go ahead and just hand out each of you a copy of the SLUMS, and you can turn and face a partner and just practice going through those questions with them and scoring them, seeing how they do. All of us are obviously in the middle of getting our degrees, so we're going to be above a high school level. So grade them according to that, and you can even bring it home and practice on people and see how you do with that, because I think the more you practice with this, the better you'll get at administering it. Okay, great guys, thank you. I'm gonna go ahead and stop sharing my screen, and thanks guys. Have a great day.
bye.